Okay, so you know the saying that behind every great program, there is a strong woman. I'll change that. There are strong women and men. But I have the opportunity to introduce to you someone with some particularly quiet strength. So everyone who knows Dr. Marilyn Fraser White will say to you, but she's so quiet. And as a matter of fact, I commented when I first met her, gee, she's kind of quiet, but do not be fooled. Marilyn is the engine behind our community engagement processes, and she will now come to the stage and share her comments and presentation with us.
So thank you, Pam. I think I am quiet. I don't know about what she's talking about. Anyway, good morning, everyone. Oh, wow, that was good. Well, today I want to talk to you a little bit about the work that we do in the Community Engagement Core. And I just want to talk about the importance of community engagement to addressing health disparities, also about some of the community engagement efforts that we have undertaken here at this center, and some of our novel approaches when we think about health disparities and addressing those barriers that exist within our community. As you heard from the speakers this morning, we all know that disparities exist, but what can we do to address those? We need to identify and address the barriers that occur within our community. We know that the community's voice is essential to that because you all that work within the community, we all work in the community, and we kind of like have the pulse of the community, and so it's important to take into account what the community says about what's going on there. And bi-directional partnerships, those are essential. We need to partner with academic institutions, we need to partner with community, we also need to partner with government institutions as well. And we need to tailor the work that we do. So the research has to be tailored to the community in order to address the issues there. And the center supports the development and implementation, the evaluation and dissemination of high-quality, community-engaged research. And we do that with a diverse community advisory board, and you'll see the list of our members of our community advisory board. We do that with our stylists and our barbers, members of our faith community as well. And when we think about the role, as I said before, the knowledge of health issues is an essential part to what the community brings to the table. You are the advocates for change, and we would like to think of you as active partners, and it's essentially important that we employ a method of community-based participatory research where the community is involved at all aspects of the research. We have, as I said, a really diverse community advisory board. It's made up of 13 various community-based organizations, and they represent a lot of the social determinants of health issues that we need to address. And our community advisory board was essential in creating a shared research and policy agenda that has guided the work of the center. So some of our current initiatives, I'll just go through these briefly. We have a Health Disparities Summer Internship Program that I'll speak about in a few minutes. You'll hear from Dr. Michael Joseph, who is the director of our Research and Education Training Core, and he'll talk to you about that program with underrepresented minority research students. We've also conducted various community-based training to increase the capacity of community-based organizations to participate in research. We have our Barbershop Talk with Brothers project that I'll speak to you briefly about, and our obstructive sleep apnea project. So for the research sub-projects, the Barbershop Talk with Brothers is a project that we have been conducting at the Arthur Ashe Institute in collaboration with the School of Public Health here at SUNY Downstate Medical Center. And we're looking at HIV/AIDS risk reduction in heterosexual African American males. Also, another part of this project entails prostate cancer education. And we know, as it says, barbershop, so the barbershop is the venue where we recruit, and we also conduct our training within the community. And we try to reach people where they are. So going into the community where people convene, where people congregate, we know that you speak to your barbers and you speak to your stylists more than you speak to your physicians, your husbands, your wives sometimes. And so we are utilizing that for you to deliver a message on health. The Obstructive Sleep Apnea Project is focused on identifying risk for sleep apnea in African American as men and women. And the venues that we have utilized to recruit people are the salons, barbershops, and faith-based organizations. Just to briefly give you a sample of some of the goals of the Community Engagement Corps. So we were charged with doing two things and doing them well. And so those are training our high school students on health disparities and also having them involved in community engaged research projects. The other aspect or other focus of the Community Engagement Corps is to increase the capacity of community-based organizations to conduct research. And what we have done so far, many of you in here have participated in our Health Disparities Summer Internship Program. This program will start its 5th cohort in July of this year, and we've been doing this year would mark 5 years since we've been doing this, and the students are recruited from the Institute's Health Science Academy, which is a 3-year after-school science enrichment program for students that are interested in pursuing careers in the health professions. And we have a didactic training. The students come here during the course of a month, and they have training on health disparities. And then they go out to various community-based organizations with which we partner, and they conduct a research project. And it's always amazing to see how much they accomplish in such a short period of time. Because within 4 weeks, well, 3 weeks technically, because in the 4th week they have to present their posters and they have to gather that information to make sure they analyze their data and present their posters. And it's usually amazing to see how much they accomplish in partnership with our partners within the community. So we've had over 60 research projects that have been conducted by our high school students. And it's very important to mention that this program has also been replicated in Trinidad and Tobago. And this year will mark the 3rd year of our conducting that program in Trinidad. In terms of some of our partnership outcomes, we've had community engaged research projects which have leveraged the community partnerships that we have, our community partnerships with our barbers, our stylists, our faith-based organizations, and our community-based organizations that make up our community advisory board. They have served as the anchor for some of our sub-projects, as well as the sites for which our students are hosted during the summer. We have also conducted various community training workshops to increase capacity to conduct research, and we've had faculty members that have assisted us in that endeavor. I know when I've gone out to various community-based organizations or members of our CAB more recently, they have mentioned 2 of the workshops that they really like. One is conducted by Dr. Michael Joseph, the one on SPSS, which gives them an opportunity to analyze data. The other is conducted by Dr. Tracy Wilson, where they have learned to develop survey instruments. And I know going forward, these are things that we would like to continue as in our center. We've also, as Dr. Mark Stewart mentioned, have a community-focused journal club. We have been able to secure access to the library for our CAB members, and the shared community engaged research agenda, research and policy agenda, is really essential to guiding the work guiding our work in the center. We have also presented at various scientific meetings, presented the work of the students, presented the work of our CAB as well. This is just, I guess, hot off the press, so to speak, but it's online. This is our online journal that has just been posted a few days ago, and it chronicles the work and highlights the work of the summer research programs, both in the US and also in Trinidad. And you can get that link from us at another time. And just thinking about our future directions, we want to continue to engage the researchers here at SUNY Downstate to participate in workshops for community-based organizations. We want to foster and maintain that bi-directional partnership. And when we talk about bi-directional partnership, we are talking also about funding, that equity in funding amongst academic institutions and community-based organizations as well. In light of the new Affordable Care Act, We want to revisit that shared research and policy agenda. There may be priorities that might have changed over the course of the last couple of years, and we would like to continue to look at that in terms of providing guidance for our center. And I want to conduct grant writing between community-based organizations partnering with academic faculty here, and so that we can address some of the priority areas that were identified in our shared research and policy agenda. As we think of community engagement, we think of community engagement guiding the future direction, and we would like to know that as part of the community engagement core, that we're making a transformative change in terms of addressing health disparities. So when you think of community engagement and thinking of our work to change behavior as well as changing policies, changing those systems, changes that need to be made in order to address health disparities, ultimately we do want to do these things so that we can improve the health and well-being of our community. Lastly, I would like to acknowledge the folks that are part of the community core, the community engagement core, that work tirelessly. So I know Nicole Primus, I thank you for all the work that you have assisted in this endeavor. Our core director, co-core director, Dr. Michael Joseph, and Humberto Brown, who is our seminar series director. And I just thank everyone for being here today, and I thank the staff of the Arthur Ashe Institute for all the work that they have done in this endeavor. So that's it for me at this time. So I know Saida is probably like, why is my picture up there? But at this time, it gives me great pleasure to introduce to you Ms. Saida Dunstan. She's the Director of Programs and Training at Diaspora Community Services. This is one of the community-based organizations with which we have partnered since the inception of the Disparities Center. And I know that's like, it's been about 10 years now. I was just 10 years then, wow. Thank you, and at this time I'll ask Saida to come up and share with you.